In this video, I'd like to warn about the side effect of glaucoma drops. I'm sharing my experience with these drops which caused serious effects on my body. I'm a glaucoma patient for over 15 years. I have used the eye drop latanoprost since then. During the COVID-19, I did not go to the specialist for follow-up, so after visiting ophthalmologist and test, he discovered that my glaucoma got worse and he added a new eye drop timolol twice a day. Timolol was a very painful drop along with bad headache and burning eyes. After contacting the specialist, he said side effects are normal and will go away after a while. Fourth day, I had new symptoms including shaking body, had ache and imbalance, my mouth was shifting to the left, and I had difficulty opening my left eye, so my situation was so bad that I went to emergency room, for all tests like blood work and CT scan. They observed some abnormality in the brain, further MRI. Scan was normal. They said you had a minor stroke but is through since you take baby aspirin, which is a blood thinner. I told the doctor that I have these symptoms after I'm using the timolol, but doctor responded, this cannot be because of eye drop. For follow-up, I had to visit neurologist. So I made appointment with neurologist. He was very surprised that the result of all tests was normal. Then I explained him that the symptoms started after I started using timolol eye drop, but he was not agreed that symptoms caused by timolol drop. But I showed him the side effect in Google, finally admitted, and contacted ophthalmologist, and he changed the drop to bromonidine drop. This drop was also causing headache and itching. Anyway, I continued using the drop. After 6 months, I started having same symptoms again, but much worse. So I thought new drop might cause the symptoms. I stopped the drop and contacted ophthalmologist. He changed the drop again to dorsophthalmic, but the symptoms didn't go away. Since these symptoms was very similar to Parkinson's disease, I made appointment with Parkinson's specialist. After careful examinations, he said probably the early stages of Parkinson, but we need to do more tests and scans. So he gave me assignment, the drug to treat Parkinson, which was a very good recovery for me. So I did nuclear scan, DAT, but the result was normal, didn't show Parkinson. After contacting Parkinson's specialist, he said, may it be the early stages and the test doesn't show. In this visit, he checked the CT scan again and discovered that one of the veins from neck to brain in 50% blocked, so he referred me to vascular neurologist. She said there is a blockage, but as long as you take aspirin and cholesterol medication, it's not dangerous, but we need another CT scan later to make sure it's not getting worse. In my next visit, I asked the Parkinson specialist, if this is not Parkinson, what is it? He responded, some strokes can damage the brain cells, so it might not be Parkinson, but have similar symptoms. Since you already had a minor stroke, it is very possible that this be your case, but we treat it like Parkinson. Right now I'm under medication for Parkinson and memory loss. With this video, I'd like to share my experience to aware you of the side effects of any kind of drugs which can change your life. It's clear for me that timolol drop, just the drop, caused all problems in my life and changed my life for suffering life. Unfortunately, the drug mafia is so strong that fight with them is almost impossible. It's all about profit and not human life.